We live in the age of knowledge and technology. We are able to do extraordinary things that did not seem possible many years ago. However, just because something's possible, does that mean it should be done? Advances in modern day technology are keeping people alive for much longer than nature intended. I will discuss the issues with keeping a person alive who is no longer capable to carry out their life without the use of modern day medicine. Now, I do want to specify that I am primarily talking about patients who are brain dead, in a coma or a persistent vegetative state, or using a machine that's breathing for them or carrying out any other body functions, ensuring that they're going to be spending the rest of their life bedridden. The three main issues I will discuss are the decrease in quality of life, the excessive use of resources and costs of keeping a person alive, and giving the choice to grieving family members who may keep the patient alive against their wishes. The first topic I want to dive into is quality of life. Life is about laughter and joy and love and sometimes pain. These people aren't experiencing life anymore. They spend all day in bed and are typically unresponsive. They don't get to enjoy time with family and a lot of times can't even eat on their own. Persistent vegetative state patients are conscious, but they're unable to communicate and respond to stimuli. These people are basically trapped inside their own bodies. Arc Intern Medicine, written by Donald D. Tresh, MD, in May of 1991, stated that 78% of people who are in a persistent vegetative state have at least one bed sore. And depending on the facility that they're staying in, they could have many. These are painful infections and occur when a person's body is in one position for too long. They are open wounds. Modern day medicine can ensure quantity, but not quality of life. There is minimal quality of life to someone who's lying in bed unresponsive. Now that I've discussed the quality of life, I'm going to be moving on to the excessive use of resources and cost of keeping someone alive. Thompson Gale wrote in Gale Encyclopedia 2006 that it cost many thousands of dollars for a single day of life support. And a lot of times, these expenses will fall on the government. It is not right that patients sometimes can't afford a medication that will ensure their survival, and we're putting all this money and resources into patients so then we can simply hope that one day they might wake up. I'm all for giving somebody time to come out of a coma if they're a trauma patient, but there does need to be a limit to the time given. We need to be saving resources and money for patients who have guaranteed survival. And if we do this, we might see a decrease in the cost of resources because they're going to be more readily available. Too much money and resources are being used on patients with a small chance of ability to carry on life without the use of life support. The final topic I'm going to touch base on is giving the choice to grieving family members who may keep patients alive against their wishes. Unless someone has previously created a living will, once they're in an unresponsive state, there's no way to tell what they truly want. Now, I'm not trying to depreciate the difficulty that a patient's family has with making the decision of taking the patient off of life support. That being said, I don't think it's best for a family who is grieving to be in charge of this situation. They're in a lot of pain, and a lot of their decisions are going to be based off of emotion, and they might be keeping a patient alive who would really prefer to pass. You can also find in Thompson Gale's Gale Encyclopedia 2006 that life support exposes a patient to vast risks in further medical complications, and it can guarantee no positive outcome. Also, a patient who's been on life support for 4 weeks will rarely ever be able to come out of it and live off of being off of life support again. Now, I don't want to go too in depth here, but there was a doctor that became widely known in the 90s, Dr. Kevorkian, or his colleagues called him Dr. Death, because he believed that patients deserved a right to die. What he did was very controversial, and he basically did assisted suicides. All of his patients received a mental health screening prior to this, and it's exactly what they wanted. They were all patients who were in similar situations to the ones I'm talking about today. If you're interested in this topic, I would strongly urge you to do some more research on it. It's very interesting, and then you can make an educated decision on whether you believe someone deserves a right to die. The reason I bring this up is because I think it's very relevant to all the topics I've discussed here. And I believe that people deserve the right to die if their death is simply being prolonged. These are the reasons why I think advances in modern day medicine are keeping people alive longer than nature intended. After a certain point, there is no quality of life. Keeping these people alive is burning through resources and money. And it's not right to put this decision on grieving family members. This is why it's very important to create a living will for yourself. There's no age to do this. You can never be too young for it. Traumatic events can happen to anyone. If you aren't sure how to do this, you can just jump on the internet and there's loads of resources. Thank you so much for listening to my speech, and I hope that you guys all have a wonderful weekend.